And some more on the criminal code. The government explains the conversion from death penalty to life imprisonment. And Komodo National Park. Fee is not going to go up, according to Pak Sandiaga Uno. So, January 1st, don't worry about it going up to 3.75 million rupiah. Stay tuned for details. Selamat siang and welcome to the latest news from Bali and Indonesia. This is December 19th, 2022, and my name is Bruce. What is the weather like? 29.1 degrees Celsius, wind speed 13.3 kilometers per hour, humidity 71%. Saturday, we had a big storm, just came out of nowhere. I mean, it was massive. And I was watching the monkeys and they got caught in a torrential downpour in Ubud as well. Rainy season, of course. We're in mid-December, and so you're going to go places, you're going to expect to get wet a lot of the time. Right now, things are not looking too bad, but we've had rain every day, at least some rain every day for the last 4 days here in Singaraja, and so just going to have to put up with the rainy season because we do need rain. So let's get on with the first story, more on the criminal code. I am going to keep going on with the criminal code as long as new stuff comes out about it, because if you are living here, you need to know about the criminal code. And if you're coming here, you need to know what will affect you and what won't affect you. So let's get started. Okay, let's talk some more about the criminal code because, well, news about this is just not going to go away. Government explains criminal code's death penalty to life sentence conversion. Yes, so the death penalty can be converted to life sentence. And the Law and Human Rights Ministry Director General of Legislation, Pak Putra, said that in the revised criminal code, the capital punishment will be preceded by a 10-year imprisonment. He said that 10-year period will give an opportunity for convicts to change. And so they're going to have 10 years if they're sentenced to death. They've got 10 years before this is going to be carried out. In that time period, they can change and then they could be given a life sentence instead of a death sentence. The death penalty provision remains a controversial provision since the KUHP was started to be formulated. Pak Putra asserted that the latest version is a product of multiple sessions with experts in the field of penitentiary and input from psychologists. He explained that the 10-year prison sentence could not be used as a benchmark for a prisoner to be granted a life sentence. However, he said, the recommendation to change the death penalty will be overseen by a dedicated team that is still overseen by a presidential decree. And so how will this work out? Some of the Bali 9 that were executed, they might have been given a life sentence instead of being executed with this new provision. And so we'll just have to see how this is going to turn out. But this is a change in the criminal code. Okay, and here is the big news and very short for those of you that want to go to Komodo and have been worried about this price, and we've talked about this a number of times over the last year. Sandiaga Uno planned to raise Komodo National Park entrance fee to 3.75 million rupiahs, canceled. So the new rate, as I previously reported on, was supposed to take effect January 1st. Pak Sandiaga says no, it is not happening. He said it has been retracted and canceled, but he hasn't put any details out about why it was canceled. So this goes back to January, when the government first announced a plan to raise the ticket price at Komodo National Park from 50,000 to 3.75 million, citing it as a necessary way to source funds for sustainable conservation efforts. And there were a lot of protests. There were some people in jail, some people hurt. According to news reports, interviews with people involved in the tourism industry there, the number of tourists going to Komodo and Labuan Bajo has dropped because people are expecting this increase. Whether that's actually true or not, I don't know. That's just reports that I've seen in the press. And so, good news, the old prices are going to stay, at least for the time being. So, if you are planning on going out to Komodo to see the dragons, yeah, you can go at the old price. It's commonly believed that people from different religions cannot get married in Indonesia, and well, that's true the overwhelming majority of the time, but there have been some changes going on, some exceptions. And so is this going to continue on, and is there going to be a big change in the way that marriage is taken in Indonesia? Couples of different religions in Yogyakarta passed by PN to prevent cohabitation. And so I was talking, a few months ago about a case in Surabaya, and now here's a case in Jogja. Interfaith couples whose marriage were legalized by the district court, that's PN, have increased again. In this case, the judge decided he would ratify the marriage in order to prevent the couple from cohabiting. He said, therefore, to prevent irregularities in social life where a man and a woman live together as husband and wife without legal marriage ties, kumpul kebo, because of different religions, so they cannot carry out a legal marriage, the law must provide a way out, especially giving protection and recognition of personal status and legal status in every important event experienced by community residents, especially in matters of marriage. Now, not everybody agrees with this. In fact, the overwhelming majority of people involved in this, religious people and legal scholars, don't believe in this right now, but it is being looked at again and again. And so maybe there is going to be some hope in the future for interfaith couples being able to marry in Indonesia. In this case, the two wanted to register their bond with the registry office, the civil registry office in Jogja, but they would not do it because they said they're of different religions, and so the couple asked the court to make a determination. And when the court decided in favor of the married couple, well, then they were able to register their marriage legally. According to the official website of the Supreme Court, the two married on September 3rd, 2022. The marriage was carried out in a church in Sleman. And after the marriage, the two lived in Imogiri, Bantul. The judge referred to Article 35, letter A of Law number 23 of 2006. According to the judge, the couple had married despite their different religions. The marriage was carried out by mutual agreements supported and approved by the parents and families of both parties. The judge also referred to Articles 5 and 27 of Law number 23 of 2002 concerning child protection. That is, every child has a right to a name as self-identity and citizenship status, which is stated in the form of a birth certificate. So because the marriage between the petitioners has obtained offspring, namely a daughter, it's appropriate for the child that's born to obtain a birth certificate after the petitioner's application is registered by Jogja City Population and Civil Registration Service, said the judge. And there is another case I'm not talking about here in Tangerang, and that was okayed by a judge too, but this is being challenged by the religious organizations, the Christians and the Muslims. So some good news for lovebirds of different religions, but at this time, you're still safer if you want to get married to somebody from a different religion to leave the country if you're going to keep your own religions, or for one of you to convert here. And what about tourism? Tourism Ministry aims for higher tourist visits, income generated in 2023. Now there's some weird numbers here. I don't know. We're going to talk about this. The Deputy Minister of Tourism and Creative Economy, Ibu Angela, said that the ministry is aiming at a steep goal for its programs, which includes the number of tourist visits in 2023. According to this article, she said that they want to attract 1.4 billion domestic tourists in Indonesia next year, and up to 7.4 million international. Now, 1.4 billion. I'm not sure, is this a mistake? It's here in the article. I wonder sometimes about fact checkers. So 1.4 billion. Let's say that there's 270 million people in Indonesia. And you want to get 1.4 billion, you have to get everybody in the country to travel, 5 times approximately. One of the goals the tourism ministry is hoping to generate income from tourism that reaches 5.95 billion rupiahs. Oh, dollars, it says here. Dollars, not rupiahs. The number of arrivals to Indonesia must be larger. The spending and staying period, too. On an overall net flow, people entering Indonesia must be larger than those traveling outside Indonesia, according to Ibu Angela. Another target of the Ministry of Tourism is the added value of the gross domestic product. They want to add to that, and they want to get up to 1.279 trillion rupiahs with exports of $26.46 billion US dollars. The ministry also aims to absorb 22.4 million workforces in the tourism sector and 22.59 million people in the creative economy sector. Okay, I'm not sure why that came out workforces. It should be workers. Angela said that the Ministry of Tourism believed that the tourism and creative economy sector has a multiplier effect. I've talked about this many times. And that they can help the welfare of Indonesia's general population. She said these are huge goals that can only be achieved with synergy and collaboration. So, a lot of people are expecting next year. Is that going to happen? I don't know. What does it look like now? I was watching some videos the other day. I was watching one of Bobo's. Didn't look like there were many people down where he was in Kuta. And I was watching the monkeys, and well, there were a lot of people where they were in Ubud. So it seems like there's a lot of people in Canggu, a lot of people in Ubud. Here in Lovina, I don't know because I've never go down there. But there are people, we see people here at the harbor. When I go to the harbor to meet people that are here to visit, there's always people there now. I mean, not huge, but this is Buleleng. We've never had huge numbers. So, I don't know. Trying to figure out what's going to happen next year. You never know. You got pandemics and war. Predicting the future is a tough game. And holiday season is upon us. Known here is Nataru. Nataru is Natal and Tahun Baru put together. Indonesians love doing this kind of stuff. And so that's Christmas and New Year holiday. BNNP Bali and BNN Badung Regency performed sweeping of illegal drugs ahead of Nataru 2023 celebration. Right, well, you'd expect that there's going to be some drugs in all of these discos and clubs and whatever is down there that you've got people flooding into. Well, the government is planning on keeping that to a low level or get rid of it completely if they can. And so they've started sweeping raids, and this one has been in the press all over. So the sweeping took place in a number of nightlife venues in the Seminyak area, and it was done deploying canine sniffer dogs. And so they busted on December 14th, Wednesday evening, a security guard at a nightclub not named in the Seminyak area. He was distributing ecstasy pills to visitors. And in addition to busting him, urine tests were given to all the employees of the nightclub. According to E. Putus Agus Arjaya from the BNNP Eradication Division, he said the sweeping is based on the results of mapping the vulnerability to narcotics abuse and illicit traffic. Narcotics, which are a threat to the state, need to be handled seriously and carefully. He said the sweeping activity is not to frighten or disturb the public. It would disturb me if a bunch of cops came barging into some place where I was sitting around having a drink. This is a form of the state's presence to guard and protect the community from the threat of drug abuse and illicit trafficking ahead of the new year. He said, we thank you for your cooperation in carrying out this activity. Happy is okay, as long as it doesn't use drugs. Let's take care of ourselves and the environment from drugs for a better and healthier life without drugs. Okay, and you know, or you should know, if you are in Bali, you want to stay away from drugs. Stick with booze. Booze is legal, drugs are not. And here's an interesting story about an accident, and there were no fatalities, fortunately. This has been viral. This is everywhere. Collapsed bridge is still in the testing stage. So there's a bridge, one of these mobile bridges, pontoon mobile bridge, and it connects the land to these fast boats that go back and forth from Nusa Penida to, I guess, I don't know, Sanur or Klungkung or wherever they go from. And the movable bridge, the pontoon, collapsed with people on it, and they were all dumped in the water, and these are tourists, right? And nobody was killed, fortunately. This happened on Thursday. Now, according to this article, this movable bridge, or pontoon as they call it too, had just been completed and was being tested, but they had it full of tourists. With this incident, the region asked all parties, starting from officers at the port, as well as operators, to pay attention to the number of passengers either when on the fast boat or when going on the bridge. And so apparently there were a bunch of people kind of backed up, bunched up, was not very well organized. Too many people on the bridge. There were, according to the articles here, 35 people on the bridge, too many, and it collapsed. Now, some reports say 25 people went in the water, and some reports say 35 people in the water. Some reports have two different numbers in the same article. So all of the tourists were fished out of the water, were able to swim out of the water. Apparently, people were throwing them life jackets, and local people were helping, and some of them were swimming. No real serious injuries. There were some minor injuries and damage to electronic devices such as phones, and some phones apparently went into the deep and were lost. And so police have now come and taped off the area, and they were doing some investigations into this. And so what's going to happen to prevent this from going on in the future? They're going to be strengthening the movable bridges, limiting the number of passengers that are able to be on the mobile bridge. Additionally, giving the fast boat departure times every afternoon. Passengers have to be there and be ready to board before they do this. They don't want people hanging out on these pontoons just waiting to get in. So the idea is you get the people there, you get them across and onto the boat, and they're gone. And you don't have them standing around here. Additionally, they want to have a rail that goes through the middle of this to give people something to hold on to, because apparently there is nothing to hold on to for these. So, I don't know what else to say about this. Sometimes safety is kind of played fast and loose here. And the government said the operators have to be more responsible, but also the passengers, they need to follow the rules. Apparently, they're blaming some of the passengers for crowding in and trying to get on. And well, wasn't there, so I don't know what happened. But if you are using these and these movable bridges and you're getting on the fast boats, be careful. And you might want to not be carrying your phone with you while you do it. Stick it in a backpack or something. A couple of videos ago, I was talking about rabies in Buleleng and now dengue fever. Dengue fever cases in Buleleng decreasing. Good news. Up to December 2022, there were 821 cases recorded, and in 2020 there were 3,402, 2021 1,023, and now we're at 821. We still got a few more weeks to go, but good news, dengue is going down in Buleleng. And that is apparently partly because prevention efforts are being made by the government to suppress this. And this continues to be carried out. And that includes counseling and fogging in places where there's potential for dengue to occur. In addition to these preventive measures, in 2023, the Buleleng Health Office is going to try to implement the Wolbachia technology. And the Wolbachia technology is a result of research from the World Mosquito Program in collaboration with Gajah Mada University here. Dr. Suchipto from the Buleleng Health Office said, through this program, he's confident that cases can be decreased by up to 74%. He said, yes, it just so happens that in 2023, we will get this program. Hopefully everything will go smoothly, but before that we will conduct outreach because we have to provide an understanding to the community. And what is the Wolbachia method? Well, to summarize, it provides a biological method to manipulate mosquito population and reduce disease transmission and health burden in humans. And it's being used in Singapore right now. And this suppresses the mosquito population of eggs produced by matings between released male Wolbachia mosquitoes and urban females do not hatch. So they get together and they have some fun, mosquito fun, and they can make some eggs, but they're not hatching. So control the mosquito population. So this will be interesting to see how that works. But the good doctor reminded people to continue to live a clean lifestyle in their daily lives so as to prevent dengue cases from occurring. He said, we still urge the public to carry out the human movement for a healthy, shining life, and there is a change in behavior from the community so that they live clean and healthy. Okay, so let's clean things up, Buleleng. And BPJS, some more medical stuff here. Note, this is a list of diseases that are not covered by BPJS Health. So if you are taking advantage of the BPJS system here, this is something you want to pay attention to. BPJS Health is part of the National Social Security System, which aims at provide health protection to the community. Effective since 2014, the law stipulates that in fact every Indonesian citizen is required to become a member of BPJS Kesehatan. Based on Presidential Regulation number 82 of 2018 concerning health insurance, there are 21 diseases not covered by BPJS. Just like insurance, to become a BPJS Kesehatan participant, you have to pay a fee every month. And as long as your membership is active, you can get free health services at cooperating clinics and hospitals. BPJS is also similar to other health insurance products in that there are services that cannot be covered and some that can be covered. However, unfortunately, the government does not specifically inform which diseases are not covered by BPJS, and so this article does. And here are 21 that are not covered. Diseases in the form of outbreaks or extraordinary events. Treatments related to beauty and aesthetics, such as plastic surgery. Alignment of teeth, like braces, that's too bad. Diseases resulting from criminal acts, such as abuse or sexual violence. Illness or injury resulting from intentional self-harm or attempted suicide. Diseases caused by alcohol consumption or drug addiction. Treatment of infertility. That's too bad too. Illness or injury resulting from an event that could not be prevented, such as a fight. Health services carried out abroad. Medication and medical actions that are categorized as trials or experiments. Complementary, alternative, and traditional medicine that has not been declared effective based on health technology assessments. Contraception. Household health supplies. Health services that are not in accordance with statutory provisions, consisting of referrals at their own request or other health services that are not in accordance with statutory regulations. So in order to use this, you're assigned a doctor and you have to go to this doctor first and tell him what your problem is, and then he refers you to somebody else. Health services and health facilities that do not work with BPJS Health except in emergencies. Health services for diseases or injuries resulting from work accidents or work relations that have been guaranteed by work accident insurance programs or are the responsibility of the employer. Health services guaranteed by the traffic accident insurance program, which are mandatory up to the value borne by the traffic accident insurance programs in accordance with participants' class rights. Certain health services related to the Ministry of Defense, the Indonesian National Armed Forces, TNE, and the police. Health services organized in the framework of social services. Okay, I'm not sure what that one is. Services already covered by other programs and other services that have nothing to do with health insurance benefits provided. And so there are your 21 that do not get covered under BPJS. And that is it for today. I've got a toothache now. You know, I think I've said before, getting old, I don't mind getting old at all. I like getting old. Actually, I kind of feel sometimes like I've gained some wisdom. Maybe not, but I like to feel that way. But it's hell when your body starts breaking down. So I've got the eyes, and I got, back, and I got ankles and knees and teeth. Wow. It's like having an old car. Wow, what a drag. Okay, there's some Singaraja snippets videos, and I'm working on one, and I hope to get it out soon. There's going to be a 40-day ceremony sometime soon. I keep forgetting to ask Sue what day it's going to be, and I'm still trying to get Sue to do another cooking video. Here's a link to a bunch of cooking videos that were done when it was on this channel before we switched to her channel, and hopefully cooking videos will come back again soon. Okay, this is the week leading up to Christmas, and I expect that there's going to be more and more people coming in here. So if you're driving, be careful, stay safe. If you're out in the water, stay safe. If you're getting drunk, stay safe as well. Have a good time while you're here, but always be aware of your surroundings. Thanks for viewing. Be kind to someone today. Stay safe. And I will see you on Thursday.